Dr. Mike here. If you suffer from uterine fibroids, this is a show you don't want to miss. We are joined by Dr. John Lipman, who is changing the conversation.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. I know you have been really excited about this show, Dr. Crystal.
I have. I mean, this is a topic that I have been wanting to cover for a few years now. My family, my friends, my sister, they're all just, we need information on this topic.
Yep.
And we found an expert.
Yeah, Dr. John Lipman. Wasn't it your sister?
My sister went to one of his events in Georgia, and she left the event just feeling, full of different emotions, feelings of, you're sad because this information is just, it's not being disseminated into communities. And again, hopeful.
There he is.
Hello.
That's Dr. John Lipman. He's a medical doctor and founder and medical director of the Atlanta Fibroid Center, a state-of-the-art medical facility that specializes in the non-surgical treatment of uterine fibroids and has cared for women throughout the world. And we just learned for about 30 years he's been doing this. Dr. Lipman, welcome to the show.
Oh, appreciate it. Thanks for having me on.
So I think let's 101 first.
Okay.
Fibroids 101, right? Let's just back up.
Yep.
And if you could give our listening audience just a nice, summary rundown of what are fibroids.
Okay.
And what are some of the common symptoms that women present with?
Well, fibroids are the most common pelvic tumor seen in women. They're benign. They're not cancerous, which is great, but they can cause a lot of misery. And these tumors are common in adult women, but particularly women of color who disproportionately suffer with these fibroid tumors. It's estimated that at least 80% of adult African-American women have these fibroids, and they cause a lot of misery.
Yeah.
80%.
80%. I want to make sure we got that right.
So I think there are two things that stand out. One is they're benign. So these are not cancerous tumors,
right.
But they are a problem. And then I found a stat that hysterectomies due to these account for 40 to 60% of all hysterectomies.
Because of fibroids. Yeah.
Because of fibroids, right. And 18 to 44% of hysterectomies in young women. So these are women who can no longer have children, have a family.
So let's go back to the symptoms and stuff. How do women present to you, Dr. Lipman?
Yeah, the symptoms I definitely want to talk about, but we also should talk about hysterectomy while you brought that up. Just some quick facts about hysterectomy. Hysterectomy is the second most common surgery performed in the United States, which is staggering because half the population and 2 of the 3 people on this conversation don't even have a uterus. And as you mentioned, the most common reason why we do hysterectomy in this country, and we lead the world in hysterectomy, unfortunately, but the most common reason by far are these benign fibroids. It's not cancer, which would be appropriate. And the average age, as you mentioned, these are young women. The average age is less than 40. And I just spoke a while back at Tuskegee University in front of several hundred young Black women, and 3 of them under 30 had already had a hysterectomy for fibroids. They were in tears when they heard me talk about this UFE procedure that we do, because they didn't want surgery, but they weren't presented with any other option. And when you're suffering, eventually a lot of these women give in. So the suffering is due to these symptoms. Fibroids are the most common reason why women have heavy periods. And we can talk about what's heavy, because sometimes women bleed so heavy, so long, they think it's normal for them. It's not normal. They cause pain. They cause urinary frequency, painful intercourse. These tumors are hard and firm. They're like rocks, and they press on things. And a lot of women can feel them inside of them. They can feel on the surface of their skin. In fact, gynecologists, when they examine them, will describe a woman as a certain size pregnancy based on feeling the enlarged uterus with these rock-like fibroids.
Wow. I'm trying to get myself together here, Dr. Lipman, because I'm getting emotional.
You got this.
You have some tissues, Dr. Mike. I'm serious. Because I know so many
Take your time.
women who are dealing with this.
Right. This is
It just breaks my heart.
It's my life's work. I don't do anything else but care for women that have been suffering with fibroids. And this procedure that we do called uterine fibroid embolization is truly one of the biggest medical breakthroughs for women, particularly women of color, as I mentioned, who disproportionately suffer with fibroids. Yet, even though it's well proven safe and effective, even endorsed by the American College of Obstetrics and Gynecologists many years ago, most women never hear about it because the gynecologists are surgeons and they want to operate. They don't want to give you this great option. It's a shame. This procedure is non-surgical, no cutting, no surgery, no general anesthesia, no hospital. It's a 30-minute procedure, and you go home the same day, not only with all your parts, you go home with a Band-Aid 3 or 4 hours after the procedure's finished. A Band-Aid. And you can have children after. It's covered by all insurance. It's just an absolute shame that women don't know about this amazing transformational procedure.
As a clinician myself, Dr. Lipman, how is it possible that a physician wouldn't go through all options that are effective and safe, and coming together and making a decision as a team for letting her make that decision? How is that? That's almost malpractice to me. I mean,
the gatekeepers of women's health are gynecologists. And so if you have a fibroid issue or you have a women's health issue, you go to a gynecologist. It makes perfect sense. Unfortunately, and many studies have proven this over many years, they've done an excellent job of keeping this information under wraps. In fact, I had a gynecologist tell me, how dare you, talk about UFE? How are our residents going to learn how to take out uteruses if you replace all these hysterectomies with your benign outpatient procedure? I don't know how they sleep at night. Now, yes, we do get referrals from gynecologists here at Atlanta Fibroid Center, but most gynecologists throughout the country, including here in Atlanta, most gynecologists won't mention this as an option. Women are entitled to know all the options, not just the surgical ones, but unfortunately, that's all they hear about. In many cases, it's just the surgery. They don't hear about UFE.
So can you just describe this procedure and what's taking place? And I think to follow up on your statement, I'm trying to dig deeper. Like, are they not learning how to properly perform the procedure? Are there risks that the gynecologists are thinking is just too risky to perform?
No.
I don't know. So can you describe what's happening?
The procedure is a very simple one. The procedure is very simple, but they're gynecologists. I'm an interventional radiologist. I'm a different type of medical doctor. And I'm going through different training. In fact, 6 years of training versus 3 for gynecologists. But we are trained in minimally invasive procedures performed all over the body. We do procedures that replace what has traditionally done by surgery, now can be done from the inside. So we invented angioplasties, stents, a lot of the commonly occurring procedures all over the body that you may have heard about. But we do this procedure called uterine fibroid embolization, which replaces hysterectomy or any fibroid surgery, even myomectomy. And how we do it is the approach is at the very top of the right leg. So if you were at the very top of your right leg, where your leg meets your torso, you push down, you can feel your own pulse. That's the artery that we enter. It's called the right common femoral artery. And I can steer a little tiny catheter like a piece of spaghetti into each of the uterine arteries one at a time. Each of the uterine arteries branch like a tree, getting smaller and smaller and smaller branches till you get out to the leaves. The fibroids are the leaves of the tree. And I know what size those small peripheral branches are. And I can plug them up with this material that we use. This little tiny, like grains of sand, can plug up the fibroid blood vessels. The big trunk and the main branches of the uterus stay open, but all the fibroid vessels feeding these, whether you have 1 or 100, The fibroids die without a blood supply. And as they die, they soften and shrink. And as the softening and shrinking go on, a woman's symptoms disappear. In fact, that's how the procedure was discovered 30 or so years ago in France. People decided to embolize fibroids prior to hysterectomy to make it an easier surgery.
Oh.
We had been doing it here for cancer for many years, but this group in France said, well, we know fibroids are benign, but why don't we just embolize those prior to hysterectomy to cut off the blood supply and make it an easier operation? Well, they did that, but in this country, when we embolize other tumors, say cancerous stuff, they're right in the operating room right after it. But in France, the medical system is, socialized medicine. It's rationed care. So they got embolized, they were sent home, and they had to wait for their elective hysterectomy because it's socialized medicine. They waited 6 weeks, 7 weeks, 8 weeks, waiting for their hysterectomy. Well, what happened? Their symptoms went away. So these women would call up their gynecologist and said, I feel great. My symptoms are gone. Do I still need that hysterectomy? And the answer was no. You didn't need that part 2. You didn't need that second part. All you needed was the first part. And so that's how this great procedure got discovered like 30 years ago.
That's fantastic. Yeah.
It's one of the, I put this up. This procedure belongs in terms of significance to women with the pap smear and the mammogram. And so when I hear that gynecology, I hear it every day in my office at the Atlanta Fibroid Center, patients telling me, my doctor never gave me this as an option. I had to learn about this myself. How come I wasn't told about this? I don't know how some physicians sleep at night because they went into gynecology, I presume, to help women. This is one of the biggest helps for women of all time, and you don't mention it. It's unconscionable.
Yeah. And recovery for the embolism must be significantly easier than a hysterectomy, right?
Absolutely. So it's a 30-minute procedure. There's about a 3 or 4 hour recovery at our center, and they go home with a Band-Aid at the top of their right leg. They're in bed or couch that afternoon or evening. The next morning, they're up and mobile, walking around, feeding themselves, giving themselves the appropriate medication. They're mobile. I mean, the downtime is a matter of a few days versus 6 to 8 weeks or more, and you get to keep your uterus. One of the things that is never or almost never mentioned to these patients, what happens to you? Yes, if you have a hysterectomy, you're obviously not going to have heavy periods anymore. But what happens to you as a woman when you lose your uterus? And remember, these are young women, average age less than 40. And so now you don't have your uterus as a young woman. It changes women psychologically, sexually, bone loss, urinary leaking. You take this big fibroid-filled uterus out, and now they leak urine. In fact, the next time you're in a big grocery store or pharmacy where they sell adult diapers, check out who's on the package. Who I think belongs in an adult diaper is a 90-year-old, 95-year-old man or woman. Nope, you won't see that. You'll see a young African-American woman. Why? That's the target, and they know it.
Yeah. Yeah, I just real quick, because you kind of touched on this a little bit, Dr. Crystal. So I don't think anybody here disagrees with this. Should at least be a part of the conversation. It should at least be an option that is presented. That's what we do in medicine, right? I mean, that's how it's supposed to be done. Right. And then when it's not, I think Dr. Lipman, you and I and Dr. Crystal might think, well, because you're trying to take away a bread and butter procedure from a surgeon, that's maybe what we believe, but the surgeon's not going to admit that. The surgeon's not going to say that. So what are they saying against the procedure?
Right.
Like, they must have some talking point.
The talking point is, first is they don't mention it. And the second point is, if the patient brings it up, I commonly hear, oh, well, you won't be a candidate for that. Your fibroids are too big, or you have too many fibroids. In fact, I have a blog piece on my website at atlii.com. You can look it up. The top 10 things your gynecologist will tell you about fibroids and the UFE procedure that are blatantly false. So it's just really a shame.
So this procedure, but that's a good point. So the procedure we're talking about here, it could be 100 fibroids. It could be one huge one.
Correct.
There's no limitation there.
No limitation. In fact, the American in 2008, this procedure, we started doing this in the mid to late 90s. By 2008, the American College of OBGYN, obstetrics and gynecologists, put out a white paper endorsing this procedure as safe and effective with the highest level of medical evidence that you can have, level A. There isn't any higher.
Yeah.
And so, but yet the rank and file, they want to do surgery. In fact, again, this is the number 2 procedure, the number 2 surgery performed in the United States, and most commonly for benign tumors. So the question becomes, why are gynecologists amputating young Black women for benign disease?
So I wonder, when you have the procedure, and we do want to talk about, prevention as well, how we can maybe get ahead of what's happening. Will they eventually, are they saying that this is a Band-Aid, that maybe they'll grow back and then you'll have to repeat the procedure?
Or you mean maybe the surgeons
like
are saying
basically,
that?
because the
It's not a
tumors have a way to get more blood flow if they really want it. So I'm trying to figure out.
Aggressive tumors do. Tumors that are more cancerous are good at making them blood supply,
but not
the
benign
benign
ones.
fibroids. I would assume that's the case.
Yeah, this is typically a one and done. If you have the UFE procedure in your 40s, it's a one and done for the vast majority. It's very unusual if you're in your 40s to need a second. However, we have seen some women in their late 20s and 30s. Now they're in their mid to late 40s or 50s, and they've grown new fibroids. And we will embolize them a second time for these new fibroids. I would still say, in the unusual circumstance, 2 UFEs is still way, way, way better than one surgery.
Yeah, right.
And the women that you've treated, have they gone on to have successful pregnancies?
Yes, we've had numerous children. In fact, the chance of a woman having a successful pregnancy is every bit as good after UFE as after myomectomy, which is the surgical option for women. And you talk about recurrence. With myomectomy, they never get them all out, almost never. And so the recurrence rate for myomectomy is 11% per year. So within 5 years, over half the women need another something, because those smaller fibroids that are in the uterus when they're done start growing. In fact, some of the women wake up without their uterus. That's another thing, that you go in for myomectomy and you wake up with a hysterectomy. But presuming that they wake up with their uterus, almost all of them have living fibroids in their uterus when they wake up, versus when a woman wakes up from UFE, all the fibroids are dead. So the recurrence rate is really low. And our pregnancies are typically full term and vaginal, as long as they've never had a myomectomy. We see a lot of that. I see a lot of women that have had 2, 3, 5 myomectomies. That's malpractice. And I don't think you should ever have more than one. You could have one, but anybody after one should have a UFE after that. But the pregnancies after UFE are typically full term and vaginal, whereas if you have any myomectomy ever and you get pregnant and get to term or near term, you're getting more surgery. The number 1 surgery that's performed in the United States, a C-section.
Right.
You would think that maybe that could be the question the surgeon asks, at least. If you're with a younger woman, do you want to have kids? If the answer to that is yes, you have your answer to what you should do.
Well, going back to, go ahead.
Well, their answer is that's what they do. Woman comes in suffering with fibroids, and one of the first questions is, are you interested in children? And if they say yes, they offer a myomectomy. And if they say no, they say, you don't need your uterus any longer. You just need a hysterectomy, period, end. Your uterus is worthless if you're not interested in children. And again, that's absurd. We talked about what happens to these women, particularly young women, when they lose their uterus. In fact, there's good studies to show that women have a much higher incidence of high blood pressure, cardiac issues, stroke, hypertension, heart attacks, if they have a hysterectomy at less than age 50. And the younger they have it, under 50, the worse it is. We don't need to be doing hysterectomies for benign fibroids any longer.
Well, it's something else that I learned recently when we talk about the role of the uterus is its role in orgasm as well. So the women, apparently it contracts, and then that's a part of just having a healthy intimacy. So now,
so you're saying
just
things are a little more complicated, huh? Than it's just for babies and that's it, right?
Exactly.
Right.
So
but
not just what you're dealing with urinary bladder issues. Now you're taking away an important aspect of just quality of life.
Yeah, we could continue to talk all day long on this, Dr. Lipman. We and obviously all of us are fired up about it. Yeah, we're right on board with you, but we do want to move into, I think, the idea of prevention as well.
Like, so why is this happening in the first place?
And let's talk a little bit about your experience there.
Well, there are preventive things that you can do that will help. Unfortunately, one of the many racial disparities in healthcare is there's no research money going into fibroids. Just to give you a quick example, I mean, fibroids, there are probably 30 million women suffering with fibroids. It has a huge impact to society, over $30 billion a year to society. It's as I say, it's affecting over 80% of African-American women and women of other races too. But yet it only garners $18 million or so a year in research, which sounds like a lot of money, but it's peanuts in the research game.
Yeah, that's not that much.
So if you look at how much money they're spent, it's about 69 cents per person affected for a condition that affects African-American women. If you look at a condition that affects Caucasians primarily, cystic fibrosis, it has about 30,000 people affected, not 30 million, with a much smaller impact to society, yet it garners $94 million a year in research. That's over $3,000 per person affected for a condition that affects Caucasians, and 69 cents for a condition that affects African Americans with a much higher impact to society. So the first thing is we don't know where fibroids come from, and that's a shame because of this lack of research. But once fibroids arrive on the scene, they grow with estrogen. And so estrogen is stored and produced in body fat. So one of the preventative things that we can do, because it runs genetically stronger in African-American families, but you can't pick your parents. So there's certain things you can't control, but you can try to be as close to your ideal body weight through loss of excess body fat, healthier eating choices, exercise. There are certain, you can't avoid hormones in the food and water, but there are certain hormone-rich foods like red meat, non-organic chicken, dairy, you can try to limit or eliminate. And then there are foods that are actually block estrogen production. Colored fruits and vegetables have flavonoids in them, which again, block this important enzyme in estrogen production. So increasing your amount of colored fruits and vegetables, limiting the hormone-rich foods. And then the last and very critical piece is vitamin D. Vitamin D is the most powerful growth inhibitor of fibroids that we're aware of. But unfortunately, only 10% of African-American men or women have adequate vitamin D. And the darker the pigment of your skin, the harder it is to get it. So we tell our patients, definitely get your levels checked. Make sure if you need to be supplemented, supplement and get that. If you have a normal vitamin D, you are much less likely to suffer with fibroids than if you don't.
Wow.
Yeah, this has been a great conversation. Is there anything you kind of, wrapping this up, is there anything else you want to say, or, what's maybe your take-home message for the listening audience?
Every woman who's suffering with fibroids needs to know about uterine fibroid embolization, the UFE procedure. It's covered by all insurance. That isn't an issue. It's been present a long time. As I say, it's been endorsed. It's been proven safe and effective. The biggest issue is most women suffering with fibroids never hear about UFE, and you've got to get a second opinion from an interventional radiologist. Those are the physicians that perform this great procedure. You can't rely on your gynecologist to tell you or to even counsel you on this. They don't perform this procedure. They're not trained in it. You've got to get a second opinion from an interventional radiologist that's experienced in UFE to really see if you're a candidate. Almost 100% of patients that are told they need surgery for fibroids are candidates for UFE. So it's very rare that you wouldn't be.
Fantastic. Is there a website you could share with the audience?
Absolutely. Our website is atlii.com. It stands for Atlanta Interventional Institute. It's the parent company of the Atlanta Fibroid Center. We have an Instagram page, dr_ my last name. So it's dr_ Lipman. And if they want to watch me do a UFE procedure, as I say, it only takes 30 minutes. So we did a YouTube video. It's like 38 minutes because I'm talking each step, and it's not gory. There's no surgery. It's not gross like pimple popper. It's very easy to watch. It's very simple. It's on our YouTube page. If you go to Atlanta Fibroid Center on YouTube, they can subscribe. It's free, and they'll see a list of videos. There's hundreds of videos on there, but there's one. It's one of the popular ones. Watch Dr. L do a UFE, something like that.
Fantastic. Yeah, I bet most people probably find it boring. There's not much to it.
It's not like
it is. It's kind of, but people want to know about this, and they want to see what is this all about? Because it sounds almost too good to be true, but it is. It has transformed many, many lives. Imagine somebody having these horrific crime scene-like periods, pain. They dread the period every month, and they go through this because they don't want surgery, and I don't blame them because they don't know about this great procedure. There's over 1 million women suffering in silence on the sidelines, putting up with this when they don't have to. They can have UFE and get their life back. It is transformational.
Yeah, fantastic. That was Dr. John Lipman. He's the founder and medical director of the Atlanta Fibroid Center. Dr. Lipman, thanks for coming on today.
Well, I really appreciate you helping us get the word out because this is long overdue.
Don't forget, you go to liveforeverish.com. So many websites, Dr. Crystal. Liveforeverish.com. We have tons more episodes you can download, like, and share, comment. And of course, we do appreciate a review here and there. That's really cool. That's all at liveforeverish.com. And then our sponsor, now at lifeextension.com.
There are two things that you can do there.
What
One,
can you do?
You can find Life Extension's uterine fibroid protocol.
That's right.
We do have that. And we do talk about the UFE procedure.
And then when you're shopping and you check out, you can use the discount code podcast for 10% off, $50 or more plus free shipping and handling. That's all at lifeextension.com. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for listening.